The special population I chose for this assignment was the population of individuals living with HIV and AIDS. In this video, I will go over what HIV is, the symptoms and the transmission, social determinants, insurance, and current issues and legislation of HIV in the U.S. healthcare system. HIV, or human immunodeficiency virus, infects the cells of the immune system. With this, the immune system deteriorates over time, diminishing the body's ability to fend off infections. AIDS, acquired immune deficiency syndrome, is the most advanced stage of HIV infection. You might know you have HIV after experiencing some flu-like symptoms for a few days to several weeks, and then getting it tested in a hospital setting. The treatment for HIV is called antiretroviral therapy, aka ART. This treats the infection, and people on ART take a combination of HIV medicines called a regimen daily, and this reduces the amount of HIV in the body and can reduce transmission. When looking at the determinants of HIV and AIDS, it is easy to first look at individual level determinants such as high-risk behaviors like having unsafe sex and injecting drugs, and these are major drivers of disease transmission and acquiring, but they don't happen alone in a vacuum, and there are many other factors that play a role in being more likely to get HIV or AIDS. And this is why HIV prevention sometimes is a bit iffy because it's dominated by individual level behavioral interventions, not necessarily the environment, and this is why the numbers and incidence of HIV and AIDS hasn't decreased as much as we would like because they're only targeting the certain individual risk behaviors. In an article from Pelosi and her colleagues where they looked at HIV through a health disparities framework, they found that HIV nearly exclusively impacts those who face economic adversity, and they also quoted the CDC, which reported that HIV prevalence is highest among people who are at or below the poverty level. It was also cited that poverty can be a pre-morbid condition that is just exacerbated by HIV. The treatment is expensive, and a lot of the people who have HIV or AIDS are covered under Medicare or Medicaid, and because the treatment is very expensive. The regimens of medication are expensive, and it's not taken over a short period of time. It was also cited that African Americans accounted for 44% of all new HIV infections while making up only 14% of the US population. That is a CDC statistic. Another big issue with HIV and AIDS is that many people who are HIV positive are unaware of this fact. In a study I read, in the United States in 2002, 38% of adults reported ever being tested for HIV, and only 10% had been tested in the past 12 months. For the amount of people that have it, since it is an epidemic, this raises concerns as to why people aren't being tested, especially pregnant women who have a really high chance of passing HIV to their child. Recently, there has been more attempts to make screenings mandatory for adults, for young adults and for older adults as well. Unfortunately, individuals who find out they have HIV may be delayed from when they first got it, and the treatment is not as effective as it can be. This points back to education as well as access to healthcare. Since people with HIV and AIDS usually come from a lower SES status, their education on health may not be as well versed as other individuals. Because of this too, they may not have routine access to primary care and may find that they have HIV after something gets really bad and have to go to a hospital to find out. In recent news, President Trump announced in his State of the Union speech that he wants to end the HIV/AIDS epidemic by the end of the next decade. However, he did not present concrete plans to do this and how much money that they would need for this. In other news, California has become the first state to pass a law to allow HIV prevention pills to be dispensed without prescription. This will allow access to the drugs, especially in rural areas, and reduce the stigma around the drugs as well. To summarize what you should have gathered from this video, HIV is the virus that can cause AIDS. It attacks the immune system and prevents the body from fighting off infections. HIV is also prevalent among African Americans, poorer people, and more men than women. Also, there's treatment for HIV, but it is very expensive, and the vast majority of people who receive HIV treatment are covered under Medicare and Medicaid. Discussion question 1. How can treatment and prevention programs for HIV and AIDS target root determinants, such as poverty, education, and race? Discussion question 2. Do you think there is a stigma against HIV and AIDS patients in the healthcare setting? Does this stigma, in your opinion, compromise willingness to obtain treatment and disclose one's HIV diagnosis?